Hi, I'm Adam Lane Smith. I'm an attachment specialist. Did you know that 1 out of 7 American boys is diagnosed with ADHD? That's according to the CDC, the US government. 1 in 7 boys is diagnosed with ADHD. If that number seems high, I'm with you. We are medicating boys for problems that they may not have. Now, I want to get this straight up front. I do believe that some people do have ADHD. I do believe that it is a condition. It seems to be neurological. Some people argue that it might be a different adaptation of a brain designed for more entrepreneurial skills. People with ADHD seem to do phenomenally well when they work for themselves. They just don't work very well in our current society. And for them, stimulants often have the opposite effect. They can drink 3 cups of coffee and immediately go to sleep. It actually makes them tired to drink caffeine. That's why we medicate ADHD with stimulants. In America, however, we overdiagnose. I truly believe in America that 1 out of 7 boys does not have ADHD. That's about 13% of US boys, more than 10%, more than 1/10. For a different neurology, that seems rather extreme. And it's much lower for girls. It's only about 5.9%, somewhere in that range, according to the CDC, if my memory holds. Why do we overdiagnose with ADHD? Most likely because ADHD symptoms are incredibly similar to anxiety symptoms, to attachment symptoms, to broken attachment. Broken attachment, which is under the surface, which isn't visible. We typically diagnose boys with conduct disorders only when their conduct rises to the point that they are breaking laws or causing severe disruptions. Severe. But often in schools are the ones pushing a diagnosis of ADHD. Teachers diagnose the kids with ADHD, and their parents are ordered to medicate them. I've worked with so many parents over the years in my work as a therapist, as a family therapist, and heard so many horror stories and seen them firsthand of teachers and principals coming together to force children to be medicated without a doctor even being involved up front. They force that parent to take their child and get medicated, and that is a prerequisite for the child being allowed to be in the school. Otherwise, the child will be expelled. And the doctor hasn't even diagnosed that child yet. If that's the condition for your child to not get expelled, yes, you probably will. Go get your child diagnosed. Someone will say, yep, they definitely have ADHD, and give them medication. And if they are going to check that medication, demand that your child takes that medication every day before they're allowed to come to school, for the good of your child, you often will feel like your hands are tied. Most people don't have it in them to fight the government over their child and risk their child being emotionally harmed or mentally stunted, not get the education, really, is what I mean. Not get the education they need. To be educationally stunted. Just because you wanted to make a fuss. That's how a lot of parents feel. So a lot of parents just shut up, get their kid diagnosed, and medicate. What are some ADHD symptoms that get a diagnosis? Restlessness, difficulty concentrating, fidgeting, tapping your foot, not being able to focus on things, jumping around between different tasks, having a difficult time sleeping because your brain is just going and going and going, talking too much, being too active, being nervous, losing things. There are more, but some of those are the key pieces that teachers diagnose with because they're disruptive in the classroom, especially in boys. Boys are not girls, but boys are treated like defective girls in our public school system. So they're diagnosed with something they most likely do not have. And again, I do believe some people legitimately have ADHD, and some of those medications legitimately help them. But if you are a child with attachment issues, and it grows into anxiety issues, and you're misdiagnosed with a neurological piece, and then medicated with stimulants, what do you think stimulants do to a 7-year-old boy? What do you think a high dose of stimulants from age 7 to age 18 will do to a brain? But we think that's normal here in America. We think it's fine. It's just medication. A lot of those kids become angry. They get depressed. They're finding that 1 out of 2. The CDC reports 1 out of 2. 50% of kids with ADHD have a behavior or conduct issue where they're lashing out. 3 out of 10 have an anxiety issue. Something like 20%, maybe 17% have depression, or at least will report the depression. Most boys don't want to talk about depression and will completely deny it. So it's very hard to trust that number, especially if they are already under scrutiny for their bad behavior. Who would want to rock the boat more? Is it more likely that we have seen an explosion of ADHD out of control up to 1 out of 7 boys that has never existed before? Or is it possible that our broken generational attachments have been getting worse and worse and worse, and our boys are to the point where they can't sit still and function in a society that is built on sitting still and doing what you're being told? Is that possible? I think it is. I'm not saying it's absolutely 100% true that every person with ADHD has attachment issues. I'm not saying that in any way. But I don't think that we can tease that out and reliably trust that your child has ADHD and needs medication without checking for attachment issues first. It may be as simple as your child doesn't believe they are loved. It may be as simple as your child doesn't believe they are worthy of love. It may be as simple as your child believes they have to be perfect all the time and they can't, so they are falling apart. If that's your child, there's ways to fix that. I have a whole host of attachment books, articles, videos on this very channel. I have all kinds of resources out there. Other people do too. There's a tremendous amount of information on this, but attachment should be checked first before anything else, before we diagnose anything else, and definitely before we medicate everything else. Anxiety from attachment. Attachment needs to be checked first. I will say that to every single parent with every child who's ever been diagnosed with ADHD. Attachment should be checked first. If the attachment is in place and is healthy and your child still has those symptoms, definitely talk to your doctor about follow-up options. But if you have not addressed attachment at all, at the very least, it could be worsening the symptoms, and you might be medicating a child because of their attachment. You might be doubling their dose on their medication. Maybe they need the medication because they have true ADHD, but you have to double the dose because their attachment makes their ADHD so much worse. I have treated plenty of people who have an ADHD brain. They're phenomenally smart, and they have difficulty focusing, and when their attachment is broken, it makes everything so much worse. When their attachment is good and healed and they're in loving relationships and their stress level is low, they are some of the smartest, most business-savvy people I have ever met. That could be your child, if you're willing to do the work to check for the assessment on attachment, to check for the attachment, to check for the anxiety, and to push back and say, what if it's attachment? I suggest you do that. Otherwise, your child might be one of the 1 in 7 boys that's medicated, that's diagnosed. Do you want them to wear a label for the rest of their life? Do you want them to be on medication and high doses of stimulants? No parent really wants that. Check for the attachment. Check for attachment. And I'll also put this out there. Sometimes boys are boys. Sometimes a classroom of boys is like a classroom full of Labrador retrievers, and the teacher has to learn to be patient. Sometimes that's out there too. So if you are a parent with a child who is diagnosed with ADHD, or a parent whose teacher is pushing a diagnosis, or a parent who even just wonders, or if you have been diagnosed with ADHD and you've always wondered, check for the attachment first. Fix the attachment. That will fix the anxiety. Your symptoms will likely either go away and you don't have ADHD, or your symptoms will get so much better and your ADHD brain will function so much better. And then you can channel it into areas where you excel. Sometimes people call that personality type E, entrepreneur. I've heard that before. The entrepreneur's brain. I will run my own business and no one will tell me what to do. That could be you, or that could be your child. Check for the attachment first, and then you'll know what you're really looking at.